Great. So as people are still trickling in, we should just get started as well. I want to welcome everyone today and thank you for your time in attending the University of Manitoba Rady Faculty of Health Sciences COVID-19 Q&A with Raman Dhaliwal. I hope everyone's been able to at least get out and enjoy some nice weather for the one day that we have this week. It's quite nice outside. And I do want to just cover a few things before we get started and I pass it over to Raman. So my name is Jackie Gruber. I'm a white European settler. I'm of Jewish descent and my pronouns are she, her, and hers. And I work as the Director of Equity, Diversity, and Inclusion at Rady Faculty of Health Sciences. And it's my pleasure to introduce Raman Dhaliwal, our Director of Administration and Operations, who's been instrumental and has done so much work in our response to COVID-19. So before we begin, I do want to do the land acknowledgement. So the University of Manitoba campuses are located on the original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, Inuit, and Dene peoples, and on the homeland of the Métis Nations as well. We respect the treaties that were made on these territories, acknowledge the harms of the past and the present, and dedicate yourselves to move forward in partnership with Indigenous communities in the spirit of reconciliation and collaboration. Whenever I read land acknowledgements, I hear them too, I always like to think, what does that mean to me? So for myself, it means locating myself on the land, and that's why I introduced myself as a white European settler. It means learning about the true history of the past, so taking, for example, the Manitoba Indigenous Cultural Safety Training as well. And it means also listening more than speaking. And so when these are read, think to yourself, what does that mean to you? And so now I'm going to pass this over to Raman for the rest of the session. And just to remind everyone that this is being recorded today. And so if everyone can mute themselves, you can use the chat for questions. We will be monitoring that. If you prefer to ask a question verbally, just use the raise your hand function, and then we will also be looking for that and call upon you to ask your question. So I'll now pass it on to Raman.
Thanks very much, Jackie. And thank you very much to the Family Center for organizing the Colleen and Boonmi, thank you very much. And also a special thank you to everyone that's able to attend. It's certainly my pleasure to be here. And I think I can speak for all of us when I say this last year has certainly been challenging for all of us. I think the challenges of COVID have really brought us together as a faculty, and truly been a pleasure working with everyone to navigate through these unprecedented times. So just to start, just a way to frame the conversation, I just wanted to review the COVID numbers globally, also within our province. And so the confirmed cases of COVID-19 worldwide, there's been 94 million. In Canada, 720,000, and provincially over 27,000. And so just as a reminder, when we last presented this information to you in November, the provincial numbers were about half what they are today. So just shows how quickly things have changed and progressed in our province. As of yesterday, there are over 279 people in hospital with 37 people in ICU. So those numbers are certainly improving. Provincial test positivity as of yesterday was at 9.9%, and Winnipeg test positivity is at 7.4%. So certainly trending in the right direction. And our Acknowledgement leaders do point out that out of all of the new cases being reported, that 60% are in First Nations communities. And I just would also like to recognize the remarkable effort by that group in dealing with the First Nations response of COVID-19 across the province. So as you're all aware, Winnipeg and the province is currently in code red, and the current public health orders expire this Friday. We will be watching that closely to see what that means. Just by way of reminder, when we went into code red, there were really implications for post-secondary institutions. We remained open. There were some impact on closures extending beyond the break. And so just to bring that back to the University of Manitoba context, so in fall term, Rady Faculty of Health Sciences took the lead in reporting COVID cases across the university. To date, there have been 85 COVID-19 confirmed positive cases across all University of Manitoba campuses. So this includes Fort Garry, Bannatyne, and William Norrie. And these are cases where there was on-campus exposure, either through the communicable period or through the individual being symptomatic on campus. Out of those 85 cases, 7 of them are in Rady Faculty of Health Sciences. So it's not surprising that we make up over 50% of the total cases that have been reported. We do have that are in placements and participating in the care of COVID positive patients. As well, we have a lot of in-person approved academic activity and research activity due to the nature of our. The breakdown of COVID cases is listed. The highest cases are reported in medicine and nursing, and with 0 cases currently in the College of Pharmacy. And important to note that these case counts are not just students, they include staff and faculty as well. So in a large faculty such as ours, communication is both important and also can present us with some challenges. And so as a way to structure our response to COVID-19, in March 2020, we did establish an incident command structure. This type of structure is utilized heavily both within the health system and some other organizations. And so we decided to mirror our response to what the health system was doing to allow an effective and efficient way to facilitate decision-making, communication, and also to have accountability. So the Rady Faculty of Health Sciences Incident Command Structure has a senior leadership table, which consists of the Rady Faculty Dean, the College Deans, the Associate Dean of Undergraduate Medical Education, Associate Dean of Postgraduate Medical Education, and myself. We also have another table, which is the Operations table. This group consists of directors, managers, administrators, all responsible for executing HR, finance, and operations functions within Rady Faculty of Health Sciences. This operations group has a significant amount of individuals that have a direct reporting relationship into my role. So the command table, so that's that senior leadership table, meets weekly and is a way to facilitate decisions and issues related to COVID-19. Notes are provided at each of those meetings, and the idea is that after those meetings, then those areas of responsibility, those notes are then shared with them. Operations table is chaired by myself. We meet bi-weekly, and again, it's in operationalized decisions that have been made at the command table. Notes are again shared to ensure that there's ease of communication and furthering the information within the areas of responsibility. Outside of that, we also meet regularly with student groups to solicit feedback, as they don't have a say in some of those other tables. And so we meet with the senior six, that's the dean and myself, and we receive regular feedback from students outside of that as well. So we have continued to receive some feedback on our communication strategies, and we continue to adapt as we move through the COVID-19 pandemic. It's important to note that sometimes our communication is influenced by institutions other than our own. So for example, the health system will make a change that needs to be communicated. And so therefore, that's something that's out of our control, but certainly needs to be communicated within Rady Faculty of Health Sciences. Any communication that requires more broad reaching capacity is through Rady communication. Other items are communicated through that command structure, as well as using managers, directors, supervisors as a way to facilitate that as well. I'd also like to mention that we do have a COVID-19 mitigation committee. That's a committee that Jackie chairs, and they bring very valuable feedback back to us as well that we incorporate into our next steps also. So in November 2020, we were approached by the province to see if we had some capacity to be able to store the Pfizer vaccine. As you know, we have a lot of research capacity within Rady Faculty of Health Sciences and -80 storage space resulting from that. So our Department of Regenerative Medicine put forward the capacity to provide that storage space. Within a couple of weeks, we were also asked by the province to provide logistical IT support for the first 3 weeks of the COVID-19 clinics. This included screening, navigation, IT support, security support, as well as physical plant support. So we were successful in being able to support them with that. Through that effort, we were able to get 4,500 healthcare workers immunized. Aside from that, as healthcare workers, our students are eligible for vaccination. The criteria can be confusing and it does change regularly. So we are working closely with the programs within Rady Faculty of Health Sciences to identify students based on where they are being placed. to ensure they have access to the vaccinations as they become eligible. And I've been sharing this information with public health also to ensure that our students are having access to when they do call in. We've also at the senior leadership table, that's the command table, have had lots of discussion around tracking students that are being immunized. And we've decided that we will proceed with this. This is similar to what we do with other immunizations required in our faculty. And in order to lessen the burden on the health system, we'll be using a combination of existing IT systems where this information is stored, as well as self-disclosure by students. This will be coordinated at the program level and be reported up to the Rady faculty level for statistical reporting purposes. At the request of Shared Health, we were also asked to coordinate the student and resident sign up to participate as immunizers in the COVID-19 vaccination efforts in the province. There was a remarkable response. Over 300 students signed up. We have had some back and forth with respect to Shared Health on clarification of our students and the training that they would be required to take to be able to participate in this effort. We will be mounting a similar effort to solicit faculty interest in supporting these efforts. We are just waiting for the health system to catch up on their capacity with respect to COVID-19 vaccinations, and we'll start that. We will also have other opportunities to support testing sites, AIA, and First Nations immunization efforts, which will be communicated soon through Rady Faculty of Health Sciences as well. So I just want to take the time now to acknowledge the remarkable efforts by faculty and staff and students to continue operations and continuing training within Rady Faculty of Health Sciences. We have had, since fall term, over 300 reports of students self-isolating or going for tested related to COVID-19. We've also had students bring forward concerns around in-person exams. We've been very flexible in accommodating the needs of students, staff, and faculty as we move through the COVID-19 pandemic. As a result of this, it does mean some of our winter term end dates and graduation dates will be impacted. We have applied through Senate Executive for approval for some of these dates to be changed. The programs in which there are impacts are noted, and hope to have that approval in place very shortly. The colleges have already started operationalizing and planning for some of these changes. As I mentioned earlier, we have a lot of in-person academic activity occurring on our campuses. In order to support students that need to be here over the lunch period, we have added additional lunch space capacity within the Brody Center. So we have over 100 spaces now for anyone needing to be here over the lunch hour, which accommodate physical distancing, cleaning, and are in line with the public health orders that are currently in place. There's also an escalation process that has been established for anyone that is not able to find a space, so that we can help solve that issue. In the fall, at the beginning of the fall term, we established several study spaces, both at Fort Garry and the Valentine campus. Those will continue to be accessible. The feedback I've had from students is that those seem to be sufficient at this time. Have heard the College of Dentistry requires a little bit more study space, so we'll work with that student group to address that issue. We've increased the after hours access points into our campus to try to keep everybody safe. Previously, the only after hours access was through the main Brody Center door. We've now expanded that to include Apotex as well as dentistry. We also have access through BMSB on the main floor through HSC for any of our students that are on clinical placements. The tunnel access through HSC remains in place. Also, the Safe Ride program has ramped down just due to health and safety concerns of being in close proximity in a car like that. However, to address this issue, Parking Services has made parking permits available for students that need access to park at the Valentine campus. Also would just like to note that Rady Faculty of Health Sciences helped move forward a proposal to Central that brought parking fees in line for those individuals that were working from home versus those individuals that needed to be on campus due to the nature of their work. So if you're working from home and didn't need to be on site, your parking fees were reduced to $10, whereas those individuals needing to come on site were paying the full amount. And so we strongly advocate that those should be brought in line, and those efforts were supported through Central, and I believe those changes have been made. And so we continue to evaluate public health restrictions, especially with relation to travel. So we have PGME residents as well as students in College of Rehab Sciences and the OT and PT programs. They travel out of the province to complete required clinical experiences for graduation. The current public health restrictions recommend strongly against non-essential travel. Not to mention, we now have a new variant that's being reported in several provinces across Canada. And so we've taken all this into consideration and have decided to pause incoming and outgoing external electives for blocks 8 and 9 in the PGME programs, and out-of-province placements in the College of Rehab Sciences program for January 14th until the end of February are being reviewed on a case-by-case basis. And we continue to update this as more information becomes available. So in order to continue to provide a safe work and learning environment, we do have limited in-person activities. So only those activities that require individuals to be on site are on site. In October 2020, in response to the increasing COVID cases that were being reported, we did revert clinical reasoning back to being remote. So some programs had chosen to do this in person. And in light of those changes, we moved that back to remote. We've been very mindful about our in-person exams with SPs. They've been either delayed or canceled as we moved into Code Red, or modified in order to ensure we can continue to operate within the public health orders and restrictions in place. Research activity was ramped down to 25% as well. And of course, our favorite topic of PPE. This is an area that previous to the pandemic, Rady Faculty of Health Sciences really had no involvement in. We did have to stand this up quite quickly in terms of procuring and providing PPE. We are certainly not the experts in this area, and so have relied very heavily on our partners at Shared Health and also in public health to provide us with guidance and feedback on our PPE approaches. We've used their guidelines in our own implementation, and just would like to really acknowledge several faculty members that have lead roles at Shared Health as well that I email daily, and they always respond. Alan Kraut, John Embel, Lynette Saragusa, Perry Gray, the IPC team at Shared Health, as well as the operations table, have been very responsive and have really assisted us in being able to carry this out. So as part of my work as Director of Administration Operations, Rady Faculty of Health Sciences, I have the pleasure of being on the provincial operations COVID-19 calls. At that table, I'm privy to information about any changes with respect to operations in the health system that would impact our learners, and also have informed our PPE strategy. And so at that table, we've learned that the health system is now transitioning to full face shields as opposed to eye protection. And so we will be evolving our own PPE guidance to be in line with this. So currently we are looking to source face shields that have similar specs to what the health system is providing. And we will be looking to transition that into the hands of faculty, staff, and students that require it for in-person academic activity within the next couple of weeks. In the meantime, please continue to use the eye protection that you have been provided. Again, it's been vetted through Shared Health, meets all of their requirements, and is completely appropriate to continue to be used until we can catch up with that. Screening will continue. We've done a lot of work in this area, and we'll likely continue this effort for now. If we decide that screening is no longer required at some point, managers, directors, supervisors, deans have really worked hard in ensuring people have card access to our facility. And so should we decide to move away from that, we'll still continue to operate with being locked down with access through card access only. And we've really increased the card access points around the campus as well to facilitate that also. So another area that we really had to pivot and support quite quickly at the Rady Faculty of Health Sciences level was N95 Mask Fit Testing. So just by way of some background on this, medicine and nursing students previously were fit tested by Shared Health. As the pandemic unfolded, clearly their needs for fit testing also increased with ours. And so they did not have the capacity to also fit test our students. And with the increasing cases of COVID within the province, this presented us with some challenges. We wanted to ensure that our students were remaining safe in their placements, and decided to contract external companies at a pretty high expense to come in and fit test our students. And to date, so within a month, we've fit tested over 1,000 students. And so that's been really a remarkable effort by a lot of people within the programs, as well as at the Rady Faculty of Health Sciences. Another area that we've seen a lot of improvement in is working with OSH. So OSH screens all of our students when they're returning back from isolating or going for testing for COVID-19 or testing positive when they're in a placement. When they were not in a placement, we were trying to handle this workload internally with over 300 reports. As I mentioned, that was an extreme workload. And plus we had a dual process for our students, which could have been confusing. And so therefore we worked with our partners again at Shared Health, and OSH now does this function for us. And so students have one process regardless of whether they're on our facility versus in a placement. So I think that's been helpful as well. And as was mentioned at a previous town hall, we will be reviewing the ventilation systems. There was concerns about perhaps having more portable air purifiers in areas where faculty and students were in the same space for a long period of time. So we will be starting that work shortly. And again, just want to acknowledge the tremendous efforts at all levels at faculty, staff, and students have done to continue operations. It's not easy juggling work life and home life right now, and that's resulted in some vacation banks that are higher than they normally are. So just as a periodic review, we noticed that ACES and EMAPS vacation banks are sitting at high balances right now, but we also completely understand the operational demands on individuals have significantly grown with COVID-19, as well as responsibilities outside of work. So we are going to ask managers to review some of these items with their staff to see if anything could be done. We will be flexible in that regard. There will be some central flexibility as well. And as we all pivoted to work remotely quite quickly last year, it meant that we were implementing a lot of different technologies and we were all learning at the same time. And clearly that led to a lot of bumps along the way. And so ExamSoft and Respondus were two tools that were used to deliver remote examinations in Rady Faculty of Health Sciences. Respondus is a tool provided by the Central University. ExamSoft was previously being used in undergraduate medical education and has been adopted in colleges of nursing and pharmacy. We've now successfully completed one round of exams using both of those tools, and we will be looking to feedback from faculty, staff, and students to see their preferences and how we would move forward in this regard. And we're not looking to make any changes with anything anytime soon. We also are going through a migration to Office 365. Colleges of nursing, pharmacy, and dentistry have previously migrated. Colleges of medicine and rehab sciences will be migrating this month. We tried to delay that as long as possible, hearing from everybody that there was some technology fatigue, but we're kind of at that point now where we need to do this. And so we'll be working closely with Central IST. That will allow everybody more access to Teams. We will continue to use Zoom despite other platforms being available. Zoom definitely seems to be preferred in our faculty. We have over 500 licenses of Zoom right now. We have no intention of changing that. Those will still be available to support academic and other activities. We are requesting that for any research requiring recording, that people do use Teams for that purpose, just because we're not set up in Zoom for that. And there's an established process to record through Teams already. So as I mentioned, we are currently in Code Red. Those restrictions expire this Friday. We'll likely engage in a discussion with the university around what that means for us. We all know, and it's been communicated, that summer term will continue to be done remotely. So we're still continuing to work remotely for the foreseeable future. There's been strong interest from our researchers to start ramping activity up, and we will certainly start having those conversations when we know a little bit more about what the public health changes will be this Friday. And I think we can all say that we've seen an effective transition to working and learning remotely that needs to be considered in any future discussions about our return to campus. And so I anticipate those discussions to start very shortly. And lastly, just again, would like to say a huge thank you. We appreciate everybody's suggestions and feedbacks. Please keep sending them in. They really help inform how we move forward. Please visit the Rady COVID website for any updates or any material that we've distributed in the past. It's all logged there. And of course, please stay home if you're not feeling well, and help us keep everybody safe. And with that, I'll turn it back to Jackie for any questions from the group.
So we're just going to open it up to questions. And thank you so much, Raman, for presenting all that information. There's so much that you've been active with, and we really appreciate all that you are doing as well. So thank you from Rady Faculty of Health Sciences for all your work. And I just want to open it up to the floor to see if anyone has any questions. Again, you can either put it in the chat function or raise your hand and we'll call upon you. Oh, I see a question. I'll just read that out to you, Raman. So Raman, you mentioned an established process for recording on Teams for research. Where and how can we find out more about that?
It's a great question. So Central IST has taken the lead in developing protocols around this, working with the Privacy Office. And so I would ask that you reach out to Central IST to provide you with that information. If you run into any issues, please contact myself and I'll help you through that.
Okay, thank you. Any other questions? And there's a lot of information that we are just provided, and do want to note that the recording of today's session will be put up on the COVID website as well, too, for everyone.
I do have a question that came to me directly.
Did you want to read that out and then I'll go to the other ones in the chat?
Sure. So it's about international electives. What is the advice message to students or residents who are planning to go to a different country for elective after June? So at this point, you can plan that they can proceed to go on that elective as of June, and we'll continue to provide updates. So right now, our direction to pause is until the end of February, and we suspect that there will be some change in the guidance at that point. And but for now, you can kind of operate under the assumption that after that time, you can continue to allow students to go on those electives.
Okay, so the next question I'll read out is, when the time comes to return to work, do you anticipate it will be graduated, return, or everyone at once?
My guess on this is that it'll be a very graduated return, just as we have gradually reopened. I think there's a lot that is unknown right now, and I think that there's been a lot of success with people working from home. And so I think we'll gradually bring people back, and there'll be a lot of discussion around that in terms of also the COVID-19 vaccination rollouts that all need to be considered.
Thank you. So before I go into the next question, I do want to, there is a comment I'll just read out. So a huge thank you to Raman for your excellent work. So thank you, Raman. And then the next question is, Raman mentioned flexibility on vacation time. What does that mean specifically for employees with a significant amount of vacation time?
That's a really good question as well. So with Rady Faculty of Health Sciences being the largest faculty within the university, we have been in an active conversation with Central HR around some of the flexibility that we would like to see. So I think it'll be a combination of being able to carry over some days, as well as potentially being able to pay out some vacation days, given the department or units or colleges capacity to be able to do that. Again, nothing has been decided there. We are waiting for central HR direction, but those are some of the things that we've asked to support the staff that haven't been able to take time off.
Do we have an idea when we'll get that direction from Central?
Very soon. So this was an active discussion before the holiday break, so I suspect we'll hear in a couple of weeks.
Wonderful. Then next question is, can we have more information about criteria for the 150 Faculty Health Sciences students meet eligibility criteria for vaccination?
So we are following the established province of Manitoba COVID-19 vaccination criteria. And so it's just when those criteria change and our students fall within that eligibility that we are helping to identify them. So there's no separate criteria for the students. It's just based on the existing criteria and when our students fit. It can be confusing just because acute care to one person means something very different to another person. And so that's the piece that we've been helping them work through. As well, our programs are the ones that schedule the placements for the students, so have really been assisting the students figure that out as well.
So that's the end of all the questions in the chat. I'm not sure if anyone has another question you'd like to ask verbally or put another question in the chat. Right, I don't see anything else. I think that will conclude for today, unless there's anything else you'd like to state, Raman?
I just wanted to remind Raman we had one question that came in.
Yes, so I remember it was around just the fact that we have done a good job of transitioning to work from home, and would that be considered in future planning when returning back to the campus? So in line with one of the questions that we've had. And again, I think that we have seen that staff do work effectively from home, and we've been able to do that. We do have a lot of in-person activity, of course, that can't be supported from working from home. However, that would definitely be taken into consideration when looking at a return to work strategy. So I think at first, a lot of people did struggle with working from home, but I think now people have found their groove and actually find it to be more beneficial. And so that's definitely going to be part of any considerations for future planning.
Thank you for the reminder, Colleen, as well of the question. And so there was another comment about providing the link where we can find the recording of this meeting, and Alana did put that up in the chat function. So that will be on the COVID-19 Rady Faculty Health Sciences update page as well, so you can find the recording there. And I always want to remind people as well that, you know, this is obviously it's different times. We're all impacted in different ways. And so just a reminder in terms of what resources and supports we have. So if you're a student, we have the student services at Bannatyne campus, and we have student counselors, for example. Leah Dean is the director. You can just Google that in the website and find more information to access support if needed. And then for staff and faculty, we do have Employee Family Assistance Program as well. And so you can just Google that. And there's a wealth of different resources that are offered to us as staff and faculty at the University of Manitoba Rady Faculty of Health Sciences. Oh, and there goes my dog. So I just want to thank everyone for your time. See if there's any last questions at all before we conclude today. If this was beneficial, we would really like to hear from you, because we can do this on a regular basis if you find this beneficial as well. So we'd like to hear that information. Oh, and then I just have another comment here that the International Center is still supporting students remotely. So if anyone has a question relating to international students, to email international@umanitoba.ca. Thank you so much, Kenneth, for that as well. And I see another comment saying that this was helpful too. So we will endeavor to look at scheduling something again in the future.
Thanks, Jackie, and thanks, Raman.
Thank you.
Thank you, everyone.
Thank you.